Kailash? Hello?
Good afternoon, sir.
Kailash, can you hear me?
Yes, sir. I can hear.
Okay, you can see the slides also, na?
Yeah.
Want to check the video?
Yes, sir. We can check this also. Yes, good afternoon, sir.
Is it okay?
Yeah, slide is showing, but video is not showing, sir.
Now?
Now also is video is not displaying, sir.
You can't see?
Yes, sir. I can't see video.
No, you just, but I am able to see my video.
Again, you have to go to share, then from share screens, you have to play the video. I think then it will be showing to all the audience.
What is it, Kailash?
Which one, sir?
Okay?
No, sir. Video is not showing.
I don't know why. Shall I rejoin again?
Yes, sir.
Try to rejoin again?
No. You are showing. Okay. Hello. Hello.
Yeah, Kailash.
Yes, sir. I can see you, sir.
You can see me?
Yeah.
Okay, fine. Just say when to start, then we will start.
Yes, sir. Only we have received join only 30 participants. Just we will 5 minutes. Remaining participants will join. Then we will start, sir.
Okay, fine.
Within 5 minutes.
Okay.
Shall we start, sir? Shall we start, sir?
Yes, Kailash, yes.
Yes. Okay. A very good afternoon, respected sir, dignitaries and delegates. I'm Kailash Nagar, Assistant Professor, Department of Community Health Nursing at DPCN. Dinsha Patel College of Nursing welcome you all in this webinar. The COVID-19 pandemic has emerged as one of the greatest challenges faced by the humankind in the past recent. The person who are suffering from the diabetes are more prone to get infected from the coronavirus. The current statistics data are evidence that the mortality rate is very high among those who are suffering from diabetes. 10% of the diabetes with die within 10 days of the coronavirus hospitalization. 1 in 10 diabetics with coronavirus die within 7 days of the hospital admission. Diabetes is one of the major risk factors for fatal outcomes from COVID-19 because of hyperglycemia, impaired immune system function, vascular complications such as hypertension, obesity, and cardiovascular disease. Thus, it's very important to have appropriate knowledge regarding diabetes and COVID-19 self-management and nursing perspectives. To enhance our knowledge in this topic, we are glad to have an eminent personality in nursing profession who may be the role model for many nursing personnels. I feel immense pleasure to introduce our eminent speaker and magnetic personality, none other than Dr. Dinesh Selvam, sir. Sir is currently working as a Dean of Studies, Medical and Paramedical at Dr. Mohan Diabetes Education Academy, Chennai. I would like to introduce by providing you glance on his journey in nursing field. Sir has done his BSc Nursing in 1997, MS Nursing 2002, and PhD in Nursing 2013. Sir has attended all the qualifications from Dr. MGR Medical University, Chennai. Sir has used work experience of 21 years in the nursing field. I'm happy to announce that Sir has received AMM Trust Silver Medal Award for Best Clinical Nurse. Sir has received Best Teacher Award for World Record by Karnataka State Pollution Control Board. Sir has received Lifetime Achievement Award for receiving for Doctor of Philosophy in Nursing. Sir is very confident, hardworking, and also high-ranking influence administrator with excellent communication skills. We feel blessed with your presence, sir. Now I request sir for expert talk, and now you can continue with your presentation, sir. Thank you so much, sir.
Thank you, Kailash. Warm greetings to everyone. And that was a very nice introduction about me. Thanks for that, Kailash.
Thank you, sir.
And my wishes and my greetings to the Maha Gujarat Medical Society and Dinsha Patel College of Nursing. I know that they are very, very proactive during this COVID time to enlighten with knowledge and with ongoing webinars and seminars to the nursing faculty and the students. It's very nice to hear, and I feel also honored to be invited as a part of your webinar series on this particular topic. Shall I share my screen?
Yes, sir, you can say.
Is it visible?
Yes, sir, it's visible.
Yes. So, the topic. Am I audible? Hello?
Yes, sir.
Yes. The Department of Community Health Nursing organizing this webinar on diabetes and COVID-19 is a very essential topic at this period, talking about diabetes during this COVID. So as already Mr. Kailash has very neatly told why diabetes is considered to be very high risk during this COVID period, and the mortality among COVID, diabetes and hypertension being the main cause. So this particular webinar focusing on this area, and I wish to say that the presentation on self-management of diabetes during COVID will be focused mainly on first what is diabetes and about COVID-19 and about what are the self-management that should be practiced by the patients and what are the aspects the nurses should know in giving the self-management care to the patient. This is how the part of webinar will be going on. Maybe knowing about diabetes, all will be familiar, but still it will be like refreshing for others. Know first about what is diabetes. So what is diabetes? You all know they say it's a disease, but basically it's not a disease. It is a disorder. So we comes under a group of metabolic disorder, and literally or very commonly you can say diabetes means it's high blood sugars, hyperglycemia, isn't it? Right. So what are the normal values? To quickly refresh, the fasting blood sugar normal value should be 70 to 100 milligram per deciliter. So usually this fasting blood sugar measured on an empty stomach. So approximately 8 to 10 hours of an empty stomach. And postprandial sugar is the other important normal value which you should know, which is measured 1.5 hours after the breakfast. It should be around 100 to 140 milligram per deciliter. So once if you check a person for blood sugar, you see that their blood sugar value is somewhere around more than 120 or 140, you should not say that the patient is diabetes. When you can diagnose, when the particular person or the client confirms that he is suffering from diabetes, one is fasting blood sugar. So it should be 126 milligram per liter or above. This is one criteria. Then they should show some symptoms of diabetes. If they are showing some symptoms of diabetes, and you take random plasma glucose, random blood sugar value, you can take at any time. If that random blood sugar value is 200 milligram per deciliter, plus symptoms of diabetes in more than one occasion, then you can say the person is having diabetes. 2 hours plasma glucose during GTT, glucose tolerance test, that is oral glucose test. You give after 2 hours, you take the blood sugar. It should be 200 milligram per deciliter or above. So in this case also, you can diagnose a person. You can say that confirm that particular person is having diabetes. And HbA1c, it's an average of the blood sugar for past 3 in any person. If it is 6 diabetes, right? So what are the symptoms of diabetes? So you all know already, but still we can refresh. The symptoms of diabetes is first excessive thirst. The person may feel that they feel more thirsty. Then you have excessive hunger. Even after having enough food, they may feel that they are feeling hungry and they will be craving to have some more food. And tiredness, they face a lot of tiredness uh, without doing any serious activities. Then frequent urination, weight loss, then persistent ache in the limb. So this they experience pain in the knee or in any part of the limb, and mainly in the ankle area, the foot area, where sometimes this pain they get at the time of sleeping or when they are resting. You call it as a rest pain, and sometimes they experience like pin pricking pain at the sole of the feet, and they may experience a spongy like feel at the feet. So these are the symptoms of diabetes in the feet, mainly when they say about the leg pain. Then they get a wound, it takes a long time to get healed, so delayed wounding. And apart from that, sometimes they also experience this itching in the private parts, right? So these are the symptoms of diabetes. What a person you should educate, or you should find that if they are having any of the symptoms, they have to check their blood sugar. Okay, so why this blood sugar is rises, or why they get diabetes? Causes of diabetes, the primary cause is hereditary. So we say it is a hereditary disease. Hereditary in the sense, both the parents, if they are diabetic, then 99% they have risk of getting diabetes. Okay, if one parent is have diabetes and another parent is not diabetes, then there is a 50% of risk of getting diabetes. So both the parents are not diabetes, but their blood relatives, their father's blood relatives or the mother's blood relative, if anyone is having diabetes, then there is a risk of 25% to get diabetes. Then there are environmental risk factors for diabetes. So mainly these environmental risk factors are caused as it is an autoimmunity where you get this type 1 disorders. And there are some factors which is also caused through environmental risk. And the other main factor which you all know already, it's obesity. So we used to say the longer you are built, the shorter your lifespan, isn't it? A person obesity, abdominal obesity, one of the main cause, and lack of exercise. And there is another important cause which is not identified by many people, that is the mental stress. So mental stress is that the recent studies show that even you have other causes being in control, the stress you experience will lead to rise in blood sugar. You all know types of diabetes. Right now we classify under three. One is type 1, another one is type 2, and another one is gestational diabetes. So as the name suggests, type 1 diabetes. You know, type 1 diabetes, insulin dependent diabetes. So you know why you get diabetes. Diabetes is caused mainly because of insulin insufficiency. If the beta cells, islet of Langerhans, is not at all able to produce any number of insulin, it is completely damaged, then you get type 1, that is insulin dependent diabetes. So these kind of patients, lifelong, they depend on insulin to control their blood sugar. Then you have type 2. So this type 2, they have insulin, but that insulin is not enough, or there is insulin insensitivity. The insulin is not enough to control the blood sugar. That is type 2. Then you have gestational diabetes. This is a diabetes which arises during the pregnancy period. There are various treatment options, but the main treatment option you can see here at the base of the triangle, you should see, that is lifestyle modification. That is the main and very basic treatment option for the diabetes. So the nurses, you keep an aware when educating the patient about their lifestyle modification. So when we talk about lifestyle modification, there are two important things. One is diet and one other is exercise. So diet, physical activity as a lifestyle modification is very, very important treatment for diabetes. Then you have pharmacotherapy. Of course, there are oral hypoglycemic agents. We call it as OHAs. And apart from oral hypoglycemic agents and insulin being the main pharmacotherapy, you also have surgery. So this surgery is mainly the bariatric surgery. Sometimes this bariatric surgery are successful, but there are no enough research studies to prove very confirmly that bariatric surgery can reverse diabetes. But as a surgery, this is also an option for the treatment. When we talk about management of diabetes, the nurses and other educators should remember four important things. We tell these four important things as four pillars. What is the first pillar? As I already told you, diet is the first pillar. What is the second one? The exercise or the physical activity. What is the third pillar? That is the medications. And the fourth pillar is diabetes education. So remember, when you talk about management of diabetes, you have to think about this four. These four we consider as four pillars in management of diabetes. Again, I repeat, diet, the first pillar, exercise, medication, and diabetes education. And this diabetes education, the fourth pillar, is a very main pillar where the patient or the person themselves are going to be aware of what is diabetes and how they can manage themselves. That is the self-management and how they can prevent from getting complications. So the self-management or the education on complete diabetes is very essential for every individual. So we can see one by one, we can just refresh one by one. So when I say diet, don't remember, you can see in the picture a plate, and this plate is divided into three quadrants. You can see the first quadrant occupies major half of the plate, and the second half of the plate, again it's divided into two halves. So the 50% of the plate is occupied by vegetables, and and the 25% of plate is occupied with whole grains. It may be rice or wheat or even ragi, anything that is available in their locality, right? The other 25% you can see it is covered by pulses, right? So this is how you should remember when you are talking diet to a diabetes person. So you should say their plate should be half filled with vegetables and remaining 25 with the rice or wheat and the remaining 25 with percentage with the pulses, right? The next one, you should opt for cereals. We tell whole grains, that is ragi, bajra, jowar, brown rice, whatever is available in their area. Why? Because these whole grains, that is unpolished, is having lower glycemic index. Okay, what is this glycemic index? This glycemic index is something where you take a food which is having more glycemic index will cause more maybe more blood sugar. It gives more, it raises the sugar level more in the blood. Glycemic index will be more. So you have to choose the food which is having lower glycemic index. So the whole grains, we call it as the glycemic index where it is very low. Then you have free foods, that is which foods you should take freely. So foods that is taken in unlimited amounts. You can see in the picture, the soup, the lime juice and vegetable salads you can take in unlimited at any time at any number. Then completely you have to avoid something called sweets, isn't it? Completely it should be avoid, and a direct sweet or any sweet or any food which is added with sweets should be completely avoided. So these things you should keep in mind when you are talking about diet. Then comes the second pillar, the exercise or physical activity. So regular exercises are very, very important to control your blood sugar. So how many times you have to exercise? Usually you have to do 1 hour of exercise daily. So 30 minutes in the morning or 30 minutes in the evening, or at a stretch, if you are able to do 45 minutes of exercise daily, it's good enough or it is what recommended. Why exercise is important? Why the person should be very active? First of all, I told you it increases insulin sensitivity. So in the type 2 patients, the insulin sensitivity is very important. Insulin is there, but because of insensitivity, it is not meeting the demand or it is not able to control the blood sugar. So this exercise, you keep yourself active, your muscles will induce the insulin sensitivity. Then it improves blood sugar control. Then it increases good cholesterol, that you call it as HDL, and reduces bad cholesterol, that is LDL. Even if you have more number of bad cholesterol, it turns to be the good, it turns into the good cholesterol after a excessive amount of exercise. Then you can maintain an ideal body weight, which is very essential. So you will not put on weight or you will not end up with the problem of obesity. Controls blood pressure, not only blood sugar, it is also having effect on your hypertension. It controls blood pressure. It improves psychological factor. This is very, very important. The psychological factor where we were talking about the stress, the very unknown cause for the diabetes, which is not realized by many people. This exercise improves positivity. It gives positivity. It improves the psychological factors in a particular individual. It enhances cardiorespiratory fitness, which is very essential at this COVID time to keep your respiratory fit, respiration, the inhalation, exhalation, and your lung capacity all gets increased because of this exercise. And the third pillar, medications, I have told you generally for the diabetes patients, they give oral hypoglycemic agents, metformin, the first line drug for diabetes, and then you have other group of agents. And the second main important is insulin. So insulin is very important, as I already told you. In type 1 patients, they are all depend upon the insulin. And now they even give a combination. Even the insulin is also added with oral hypoglycemic agents to keep the blood sugar in control with the patients where there is uncontrolled blood sugar. And the main thing is this medication should be, this medications for diabetes patients should be taken as advised at appropriate timing, and they themselves should not increase the dose. And insulin, if they are on insulin, the self-administration of insulin, the technique of insulin administration, the way of how they can administer, when they have to do all this, they should be very well known. And also there are other delivery of insulin now through insulin pen injections and insulin pump therapy are also the latest therapies which are essential. So this is the third part, medication. And fourth part, I already told you, the education, which is very essential of knowing all these three: diet, exercise, medication, and self-management. Right? What are some complications? We should know what are the complications. Diabetes, sure, it's going to affect major parts of your body. Diabetic retinopathy is the first condition. So any person with uncontrolled blood sugar or with diabetes for past 2 years, it affects their eyes. The condition is called diabetic retinopathy. They have then developed into diabetic neuropathy and reduced blood flow, vasculopathy. This too, they lose the sensation and their blood flow becomes reduced. So they lose the sensation in the feet. That's why even when they get a wound, they are not able to realize that they got a wound, and they are not able to realize the pain of any wound. And they also lose the sensation in the feet. So there is very much delay. And since also there is reduced blood flow, delay in the wound healing, or the severe patients with long duration of uncontrolled blood sugar, even amputation is very common among them. You all know it. Then you have diabetic nephropathy, 2 to 5 years of duration. The patient goes to kidney failure or affects the kidney, called diabetic nephropathy. Diabetic foot is the condition what I am talking, where you lose both the sensation and the blood flow reduction. The wound is not getting healed, and it leads to diabetic foot gangrene and at last loss of the foot or amputation. Then diabetic cardiomyopathy, it also affects the heart. It also gives you stroke at the later stage when it is very much combined with hypertension. So these are the major complications of diabetes. So now we come to the major part, monitoring glycemic control using SMB, that is self-monitoring of blood glucose. So how a person with diabetes can monitor themselves, self-monitoring. So the self-monitoring of blood glucose, you all have seen these glucometers and the strips which measures the blood glucose of the patient, which they can measure on their own and they can check on their own, even before food, after food, or after exercise, at any time they want to know. So this is one way of managing their own blood glucose. So they can make a note of it, and in the next visit they can show to the doctor and ask and say that these are the blood sugar variation they got. Now we have a different what to say, an aid for self-monitoring of blood glucose, or it is a new glucose monitoring device. So you would have not heard about it. I thought I can just show it to you. This is called ambulatory glucose profile. So we call it as AGP, as the name suggests. It is ambulatory glucose profile. It is a glucose monitoring device. So you can see in the picture how it is fixed, isn't it? In the deltoid muscle, you can see that. And this measures your blood sugar readings 24 hours continuously for 14 days. How it is possible? They are having a sensor in it. That sensor, later after 14 days, either you can send it to the center or you can give it, they will put it in there is a chip into that which will gives the complete reading of your blood sugar for 14 days and 24 hours. So it will show the accurate level of your blood sugar for the 24 hours, when it was high, when it was low, and what happens at the night time, what happens after the food. So this is an essential or a special monitoring device which helps the doctor to precisely prescribe the medicine for you and to find out when you are having this blood glucose variation. It also able to find a person going to hypoglycemia. They can detect very easily when the person can go to hypoglycemia. Accordingly, the treatment can be given. It's very easily can be administered to the patient. It measures an accurate blood sugar and it gives the reading continuously for 14 days. And it's an essential and very special glucose monitoring device which has recently come into the market. Right, this is about the diabetes. I think I have told about, I just recap the diabetes and what are the causes. You have seen about the causes and what are the main management. I told you about 4 pillars and talked about diet, exercise, medication, and patient education, isn't it? Right. Now we shall see what is this COVID. COVID-19, you all know how the name came. There is coronavirus disease 2019. The special virus which came in 2019, a very infectious virus, and they told it is discovered as a coronavirus. And this new virus, it gave a big outbreak, isn't it? Which began in Wuhan, China, you all know, in December 2019. And from there, it traveled all over the world. And now India is also got affected because of this somewhere from the month of February. And now it is a very, very highly infectious pandemic affecting the whole world. So presenting you some of the estimates as of yesterday, 9th August. So India is having around 2.15 million cases. The
Dr. Dinesh.
Hello? Can you hear me?
Yes, sir.
Yeah. Okay. So India, there are totally 2.15 million cases. And now at present, active cases are around 6,28,747. 1.48 million have recovered, you can see. And the death is 43,379 death totally. Right. If you see the fatality rate is 2.01, it is actually decreasing. You can see below 2.01 is the fatality rate. It was 2.5, 2.7. Now it has reduced to 2.01. It's actually good sign. And recovery rate is also improving. It was from 59 to 60, 62, and now we have 68.78% of them recover after getting affected from coronavirus. To specify, in Gujarat, the confirmed cases are around 69,000, and there are around discharged around 52,000 cases are already discharged, and there are deaths of 2,628. So these are some of the latest estimates. This you can very well check daily about the COVID virus status in our country. You all know, you are all aware, but still I will just project what are the symptoms of COVID-19. You all know, and high degree fever, cough or sore throat, difficulty in breathing, chills, muscle pain, and it's a new sign where loss of taste or smell. Right. So these are some of the symptoms. You all know how to reduce the spread of this coronavirus. So any person being having these symptoms, they should restrain themselves or isolate themselves from their family and stay at home for 14 days. They should wash their hands frequently with soap water. They can apply hand sanitizer, and they should know how to cough. No, we call it as coughing etiquette. And then they should not unnecessarily touch the surfaces. They should cover the mouth and handkerchief or with any tissue while coughing and sneezing. And of course, the throwing the tissue paper and even mask should be properly disposed in the dustbins. Avoid touching the eyes, nose, and mouth frequently. Use mask whenever you go, and reduce or avoid gatherings. So these are the general precautions or general way to reduce the risk of coronavirus in the population. So this particular coronavirus and diabetes patients, why we are connecting. So you all know the study has shown very clearly that a well-controlled blood glucose will help the patient to recover fast. But if a patient is having an uncontrolled blood sugar with COVID, the death rate is about 10%. Right. Why diabetes makes one particular individual more vulnerable to this COVID-19? We should know that, isn't it? Why diabetes patients, we are telling they are more vulnerable to COVID. You know, the SARS-CoV-2 is the type of virus that we have in COVID-19. This virus, it finds itself attached to something called angiotensin converting enzyme 2. You will be aware about it. This is a protein. It is present in many types of body cells. So this protein called angiotensin converting enzyme 2 is the protein which acts as the first checkpoint whenever the SARS-CoV enters into the human body. Okay? When the SARS-CoV-2 virus is going to enter into the human body, this angiotensin converting enzyme 2, ACE2, is going to attack them. It will prevent them in traveling across their body, isn't it? But what happens to diabetes patients? Diabetes patients, usually, they have low immunity, they are immune compromised, and they are very easily prone to infections. Apart from this, there are this diabetes, you all know, we call twin diseases, isn't it? Diabetes and hypertension. And also diabetes always have some comorbidities with that always, no? Like obesity and hypertension or some of the very, very important comorbidities which are already or always found with this diabetes. So, and apart from that, diabetes patients are already treated with angiotensin converting enzyme inhibitors. So you take their drugs, they are being given the drug like angiotensin converting enzyme inhibitor, mainly if they are hypertension, and these diabetes patients are mostly treated with these drugs. Because of these reasons, the virus which attacks and the angiotensin enzyme ACE, angiotensin converting enzyme 2 gets no more valid to prevent the entry of SARS virus. So this particular COVID virus enters into the body. It causes an inflammatory response to all the organs. It causes something called cytokine storm. And this storm, cytokine storm, what we mentioned, it enters into all the organs of the body, affecting all the organs of the body. So mainly you can see diabetes patients, because of their immune compromised and they are prone to infections and their comorbidities, and they are treated with angiotensin converting enzyme. These are the factors which makes diabetes patients to not able to come out from the COVID. COVID easily attacks and they are not able, because of the immunity compromise, they are not able to prevent the COVID inflammation in the body. So COVID-19 and diabetes, you can see people with uncontrolled diabetes and having comorbidities are highly risk for COVID-19. So we say uncontrolled diabetes are highly risk. So how to control diabetes? What is well-controlled diabetes? Isn't it? So well-controlled diabetes, as I already told, the fasting blood sugar should be below 120, but at least you can say it's somewhat in control, like if it is below 140 milligram per day, isn't it? And postprandial or random blood sugar should be below 180 milligram per deciliter. HbA1c should be below 6.5. Here we have put 8%, which is error. It should be below 6.5. So when you are having these values in range, right, you can say that it is well controlled diabetes. So in order to have this kind of well-controlled diabetes, what should the diabetes patients check themselves? So how they can give this, how they can manage themselves. So as I already told you, see, diet, exercise, medication, stress management, and regular monitoring are the main essential things which the nurses should educate to the clients with diabetes to check and to keep them in control with blood sugar, isn't it, during COVID? Right, regular monitoring, I told you glucometers are available, continuous glucose monitoring system. You can ask the patient to get a glucometer if they are not able to travel, mainly because of lockdown and because of this COVID, they are not able to go to personally and visit the doctor. They should have a glucometer to check their blood sugar frequently. They should know how to check their food. They should check their food checkup daily. The nurses can develop a food checking scale, or they can educate the patients what to look at the feet, any crack, isn't it? Or any wound, or whether it is clean and moist, whether it is very dry, and any corns or callus. So these are certain points or sensitivity or which the diabetes patients can check themselves to take care of their food. Weight monitoring, regularly they should monitor weight. You know, it's lockdown, being at home, no exercise, sitting in one place, eating and putting more weight, isn't it? It should be checked. And this annual checkup, there will be many patients or clients whose checkup should have been due during this quarantine period, but they are not able to go because of the quarantine or the lockdown issues. So they should know that what are the medications they should get, and they should have the emergency contact number of their doctor or the caretaker, and they should be able to manage for a certain period. Again, talking about diet, you see my plate. I already told you this plate, 50% of vegetables, 25% of protein, and 25% of starch or carbohydrate. I've shown you a very easy this plate, isn't it? So what are the other things the diabetes clients should be taking note during this COVID? Fasting and feasting. See, some of them they be in fasting, and suddenly they know that they were in fasting for today, and tomorrow, the next day, they eat more. So this is called roller coaster, isn't it? One day they will be very below without eating anything. The other day they eat more like a festival feast. So these kind of patients, their sugars also will be a roller coaster, isn't it? Uncontrolled. And should take fiber rich, fresh fruits and vegetables, at least 5 servings per day. And if they are not able to go out market, or if they are economically weak, they should be able to develop a home gardening where they can develop their own sprouts and they can have. And every house should have stock on fenugreek seeds, chia seeds, isabgol powder, flax seeds, and garlic. These are a traditional way of having and items in our home. The people in the home will be knowing about it. And limitations should be there for tea, coffee, sweets, bakery item, packaged food, smoking, alcohol, avoid. And limit salt, the bad fats, stop sugar completely. Fluid, there is no restriction. The liberal use of fluid should be there. Then other very important, vitamin C, vitamin D, zinc. Don't forget vitamin C, vitamin D and zinc supplements are very essential for the diabetes patients, right? So in this picture again I have explained, you can see the excluded food, isn't it? What are the food you will exclude? You have to completely exclude the bakery items, the fried items, and the packed items, the foods, fast foods, all are avoided. Instead, be at home. Already quarantined, you all are being at home. You can use your own traditional pattern, traditional meal, what you have in your house with lots of pulses and lots of vegetables. The normal food which is prepared homely is very essential during this time, and which gives you more protein and more green leafy vegetables and fiber rich foods, right? Okay. See, your diet, it should be like rainbow color. You can see how colorful the vegetables and the fruits, all these the patients can have. All this a diabetes person can have. You can see all range of colors and the very colorful fruits and vegetables. This is how you should educate the diabetes patients to have this kind of colorful foods to add in their diet. That was about diet. And exercise, already lazy to do exercise, and this quarantine period is not at all should be an excuse to add upon their laziness, isn't it? So as already we told, there should be 60 minutes of workout daily. Anyhow, sometimes during quarantine they are not able to go out of their house and walk, or no parks are closed, and gym and other physical exercise rooms are being closed. So for them, there are exercises which you can do it at home, which we are going to see. And one thing, every patient, you should say at least they should have 10,000 steps, not only for diabetes patients, even for a normal human being. The mantra is 10,000 steps per day. So how to do this 10,000 steps per day? It's very simple tip. You all know already, everyone have Android mobile with them. They can very easily download an app and check whether they are one day they are able to walk 10,000 steps per day. So they can walk whenever, wherever possible. For an example, you get a phone call, everyone sit or sleep in the bed and talk. No, you get up, walk for some time and answer the mobile. This gives you a walking a sort of exercise when you are at home. So whenever phone call comes, you just make a practice that you walk and talk on the call. You have a dog at your home, you can take a dog for a walk and practice it as a habit. Or in office, the people who are working in the office, don't expect that you want to sit always and ask someone to come and give you water or something. No, whenever you want to feel to have water, you don't keep water bottle with you. Go to the place where there is water available, walk and go and drink. So this is how you can keep yourself walking. The recent study shows very clearly that sitting for more than half an hour in the same place is worse than having smoking habit. So for every half an hour, or for every hour at least, the person should get up from the sitting position and walk for a few steps. This walking can be like going for having a drink of water, or they can take some paper and they want to give it to another table. They don't expect anyone. You go walk and give that paper to the particular table. So like this, you practice yourself frequently by standing up from your sitting place and practicing walking to lesser distance at least. See, I can just show you an example of how a food you take chapati, you have 3 chapati, it gives you 200 calories. It gives you 200 calories. You know, if you are taking the 3 chapati extra, like 200 calories, or in any other form you have taken, how you have to burn the 200 calories? You need 12 minutes of running, or 30 minutes of swimming, or 60 minutes of walking. Remember, when you are able to walk for 60 minutes only, you are able to burn this 200 calories. So anything which is taken above your requirements, for example, I have just shown you, if you are taking 200 calories above your requirement, this is how you have to burn out, right? And this is some of the schedule I have shown you. If the person or anyone say that they cannot do exercise since they are locked down or quarantine, or they cannot go walk the outside or to the park, these are some of the exercises which you can educate the people to do on themselves at any time, anywhere. 5 minutes of exercise for every hour. You see, anytime, anywhere, 5 minutes of exercise every hour. What are those exercise? Just stand up. Stand up for 5 minutes after every hour. This is one way of exercise. Second, you march in a place. You are standing and you do a march fast, isn't it? March in a place. And you stretch your legs, stretch, bend, stretch. Then you push the desk or a wall. You punch your hand in the air, right? And you lift your hand in the air and you work out with any water bottles or heavy notebooks. These are some sort of exercises which you can do for every 1 hour. At least 5 minutes you have to do this kind of, like stretching your, very easy, stretching your leg, marching, jogging on the place, standing up, punching in the air, lifting your hands very frequently. And apart all this, you have to sleep 6 to 8 hours per day. Because of this quarantine and because of the lockdown, the sleeping pattern is entirely disturbed to the people. They sleep more in the afternoon and they don't sleep in the night. They are very much with the social media like WhatsApp and all the Facebook. No, see that a particular person is sleeps for more than 6 hours to 8 hours per day, and do all this kind of exercise at home at any time, anywhere, for at least 5 minutes for every hour will be very much enough to keep any person to be fit, right? Stress management, very, very important. Stress is an unidentified or unrealized factor which produces uncontrolled blood sugar, and quarantine period, because of loss of job and economy, and there is a sort of hopelessness which is going to increase the stress among the persons, isn't it? So it is going to deteriorate the glucose control. So the easy thing is they should find the stressor, you should counsel them, try to tell them avoid or adapt to the situation, and you should advise the people to cope up the stress by having adequate sleep. By all this, we give two important things for the stress management is meditation and breathing exercise. Not only people with blood sugar, even a normal person or even you students, faculty can practice this meditation and breathing exercise, which is going to put you away from the stress. You would have already known about these techniques, but still I am just projecting one very important basic breathing exercise, which we call pranayama, isn't it? It's very simple, very, very simple. Sit in a comfortable position, close your eyes, you breathe in slowly for a count of 5 or 10. Then, when you feel that you have filled your belly with air, slowly you breathe out through mouth. Isn't it? For steps of 5 or 10 as you count it. So you repeat this cycle for 5 times. So you breathe in through your nose, breathe out through your mouth, or you through your right nostril. Like this, you can do repeatedly in a cyclic way. It's a very, very basic deep breathing exercise which everyone should do. Concentrate and do. It will really major part of your stress. Medicines, what you have to say for the diabetes clients and lockdown, whatever medicines they have to take should be available with them, or they can order medicines online and they can keep it safe or stock it, isn't it? They should take the medicine in time, which is also should be prescribed to them. Then, apart from all, the people with diabetes what they should finally know about in order to save themselves from COVID and also to prevent themselves from COVID is first of all, no panic. I already given you the estimates, isn't it? Even though the fatality rate is only 2%, there is nothing to panic. As I'm telling the diabetes patients, they get COVID, they will die. This kind of panic, first of all, should not be created. Then they should practice the principles of prevention as we have already shown you in the slides, like social distancing, frequent hand washing, wear a mask, you should know the cough and sneezing etiquette, and they should know how to identify their symptoms. These are some of the principles, basic COVID prevention, right? This they should practice very strictly. Then other extra precautions, they should control their diabetes, get a glucometer, monitor themselves their diabetes, that is their blood sugar level, and check it regularly. Eat healthy. I have shown you colorful vegetables and fruits, more protein, less carbohydrate, and more low glycemic. Even in the carbohydrate should low glycemic foods. Exercise regularly. Pranayama, deep breathing exercise to improve your lung function and decrease the stress. These are some of the extra precautions for COVID. And apart from this, they should know the immunity boosters, which is going to boost their immunity. As we have already seen, this diabetes patients get COVID because of their less immunity. So see that they take adequate vitamin C. You know it is available in orange and amla, the highest source of vitamin C. Or if you feel the vitamin, now even the COVID patients, immediate first line they are given with vitamin C, isn't it? Right. Then vitamin D. Vitamin D, of course, exposed to sunlight in quarantine, and we are not at all going out of sunlight. They should know that they get it through fatty fish or egg yolk, or you come to vegetarian, you get it in cheese and mushrooms and fortified milk. Or you can, the diabetes patients, diabetes with history of 2 years or 5 years, you can very well go to a doctor and check your vitamin D level and add vitamin D supplements. And zinc is another very important vitamin. It is already available in dals, pulses, and milk, what you have, it's already available in adequate. Zinc is being supplemented with that. So these are the immunity boosters which the patient should know. So not only this, there are very readily available food at home. I have shown you in the picture. You see turmeric readily available, ginger, garlic, broccoli, of course, difficult. Red bell peppers, citrus fruits, kiwi fruit, papaya, green tea, spinach, yogurt, almonds, sunflower, and shellfish. Among this 14, more than 10 foods are readily available at your home at any time, isn't it? You should use this frequently in your diet as per the other alternative system of medicine, right? Then the last, I say that the key points, no panic, don't educate the people or say the patients that they should not get panic. Control your level, practice the preventive principles, face mask, hand wash, social distancing, healthy and nutritious food with immunity boosters, exercise regularly, reduce stress and anxiety. These are the key points which as nurses we have to inform the public and the people who are scared with diabetes to practice. Thank you very much. And I think we can take some questions if there are.
Yes, sure, sir.
Kailash,
Yes, sir.
can you hear me? Yeah.
Yes, sure. Thank you so much, sir, for your excellent, very detailed presentation. Such an informative session. You have covered all the information we required as minimum to maximum regarding the diabetes. Thank you so much, sir. Now time for discussion. If any audience have any kind of questions and query, you can write in chat box or you can ask directly to sir. You can unmute yourself and you can ask to sir. Hello. If any participants have any query and question, you can ask.
Hope all understood the presentation.
Yes, sir. It's very informative, very detailed in each and everything you have covered
Yeah.
regarding the diabetes and COVID-19 also. And what kind of the anticipatory measures we have to take to in order to prevent the diabetes, you have covered very nicely, sir.
Yes.
Sir,
And these are the very essential points which our nursing students can educate the patients. Not only diabetes patients, even the common people when they are going to community area, they can advise with this.
yes, sure. Yes, sir. It's very important for day-to-day life also.
Yes.
Yes, sir. So we have received some few questions. Shall I ask, sir?
Yeah.
Yeah. How does COVID-19 affect those living with the diabetes?
Yeah. This COVID-19, as I already told that because of immunity, less
Yeah.
immunity or compromise, they get easily affected by this virus, which gives an inflammatory process to all the organs of body, mainly because of immunity compromisation. And another important thing, they say angiotensin converting enzyme, isn't it? That is a very important enzyme which is there to attack this entry of COVID virus, which becomes very weak in the patients with diabetes. This is how they get affected.
Yes, sir. One more question, sir.
Hmm.
Is there any difference in COVID-19 risk for people with diabetes type 1 and type 2?
There is no difference. Any patient who is having uncontrolled blood sugar, let them be type 1 or type 2, but if they are not having their blood sugar in control. See, diabetes patients, if their blood sugar is in control, they don't have, their risk is very minimal. But any patient, let it be type 1 or type 2, if they are with uncontrolled blood sugar. So that's why we told how to put themselves in controlled blood sugar. That's how you have seen all the points. How can they control their blood sugar?
Okay. It means both the type 1 and
Yeah,
type 2 both are the similar, more
yes, yes,
prone to get the COVID-19.
yes. If they are having uncontrolled blood sugar,
Okay.
if their blood sugar is in control, then there is no point of getting risk.
One more question, sir. Can some diabetic medication amplify the immune response to COVID-19?
No,
No.
I didn't get the question. Can some diabetes?
Can some diabetic medication amplify the immune response
It
to
will not
COVID-19?
amplify or anything. Any diabetes patients with medication for this many years, generally their immunity will get compromised.
Okay, thank you so much, sir.
Yes, and there are this diabetes medications. They require generally vitamin D for better absorption. So generally, a patient, diabetes patient, they need more vitamin D generally. But during this COVID season, vitamin D is also very essential in large number, especially with vitamin C,
Yes, sir.
vitamin D, and zinc are very essential to boost their immunity.
Yes, thank you, sir. Already, as I told, you have nicely talked about the what are the anticipatory measures we have to take in order to prevent the COVID-19, those who are suffering from the
Yes.
diabetes also. Is there any other things that the patients who are suffering from the diabetes, they have to anticipate?
Pardon?
Means what anticipatory measures should take people with diabetes?
They have to control their blood sugar, very first essential thing, and they should check with their diet and physical activity
Okay.
and control stress. These are the essential points a diabetes patient should follow.
Okay, sir. Okay, sir. I think that's all. And
Yeah,
thank you so much, sir, for
yeah,
your sharing deep knowledge regarding the diabetes and COVID-19, self-management and nursing perspective with us. I am thankful to our director, sir, principal, sir, for guidance support. And thank you all the participants and delegates. We have got around 370 registrations across the India, and some of participants has joined from the Nepal also.
okay.
we are very delighted on behalf of Dean Patel of College Nursing. We congratulate and thank you all the delegates and thank you so much, sir. We hope that you all are satisfied with our efforts. Once again, thank you so much, sir.
Thank you very much. My regards to the management principal and all the faculty and for giving this opportunity and to all the students to get benefit out of this presentation.
Yes, sir.
Thank you very much.
Thank you.